Hey, Dr. Grunch, it's your friend Dr. Rubin. I hope you're feeling okay. And I know as doctors, we have a hard time taking care of ourselves. We're like the worst patients imaginable. But there are some things that I like to talk about when it comes to managing an upper respiratory infection. The number one issue, in my opinion, is hydration. That's in the form of drinking plenty of fluids, but also breathing in warm, humidified air. Oftentimes, in many parts of the country, it's cold and dry, and that dries out the nasal passages and the lungs, which makes it easier to cough and have nasal congestion, post-nasal drip. It just feels very unpleasant. So having a humidifier that you're cleaning on a regular basis can really help, as well as rinsing out your nasal passages with distilled water that has salt packets in it to basically make a saline water that really helps clean out that mucus that is sitting there and any germs or irritants. There was actually a study recently that showed that hypertonic saline can help reduce the duration of an upper respiratory infection. If you're above the age of 12 months old, tea with honey can also be a natural cough suppressant. And if you're going to the pharmacy, make sure you read the labels carefully because, as an example, in that video, oral phenylephrine is found in Dayquil, and that is a nasal decongestant that does not work when it's taken orally. It actually does not get into a high enough concentration into the nose to create benefit. So if you need that decongestant effect, you need a nasal spray that contains a decongestant, and you have to only take that for a couple of days, otherwise you may become addicted to it. So those are just a few tips. I hope that helps people, and I hope that you're doing well.